Today's class is going to be on intellectual and developmental disabilities. This is just a brief overview of some of the developmental disabilities that we might see. When we're taking care of people in a nursing home, generally I would say the majority of our residents in the nursing home are going to be there due to the fact that they're older, they have had physical disabilities where they can no longer do multiple activities of daily living for themselves, which is why they're generally there in the nursing home. But we do have younger adults there as well, especially ones that have had some intellectual or developmental disabilities that they were born with or that they got briefly or were diagnosed briefly after birth that have impacted their ability to care for themselves. So we're going to start with just a basic term, intellectual disabilities. We used to refer to them as mental retardation, but they felt that that was very, just not a very proper term, not a very dignified term for it. And so now usually it will be referred to as intellectual disabilities. But your intellectual function is your ability to learn, to think, to reason. And so generally intellectual disabilities will be defined as an IQ score. So when a person has an IQ or an intelligence quotient score of around 70, 75 or lower, they usually have some form of intellectual disability. Now, that means they may be limited in at least one adaptive behavior or the skills that they need to either live on their own, to be able to work and be able to hold a job well, or to be able to do regular play. It is generally diagnosed before the age of 18, but one thing we have to mention, disabilities or not, the person is always entitled to the same rights that everyone else is. So this picture shows you just kind of how IQ scores tend to fluctuate. So the average person has an IQ score generally of around 85, 100 is considered above average, and 115 is high intelligence. Now, IQ scores over 130 are usually for people that have superior intelligence, and then once you get over 145, you're looking at people that are usually considered gifted in some way. When a person has an intelligence score, as I mentioned, around 70, 75 or lower, they generally have some type of intellectual disability. And when people have an intelligence quotient score of 55 or less, then generally their disability is severe that it's going to impact most areas of their life. So one of the disease processes we'll talk about is Down syndrome. And Down syndrome is one of the most common type of mild to moderate intellectual disabilities that you'll see. It's where a person is born with the extra 21st chromosome, and the Down syndrome child has certain features that are just kind of unique to Down syndrome because of this extra chromosome. We tend to see very small heads, these short, wide necks, flat nose, small ears, and kind of wide, stubby fingers. Those are pretty typical with Down syndrome. Here's some pictures of children that have Down syndrome, and you can kind of see, that short nose and the smaller ears, so the thick neck. People with Down syndrome, they generally will need help with speech and potentially with language, as well as physical therapy and occupational therapy. And many people with Down syndrome, they lead very high quality lives. They can go to regular school. They may need some assistance with their schooling. Many of them can hold jobs, and be trained in a job. There's different levels of intellectual disability you'll see, and so depending on whether it's a mild intellectual disability or a moderate one, may be the degree of how high functioning they will be. The term Fragile X syndrome is an inherited intellectual disability, and the body does not make the necessary proteins that are needed for brain development with this disease. Girls generally have a milder form of Fragile X, and it will depend on how severe the Fragile X is to depend on how much intellectual disability that happens along with it. But usually there will be a form of intellectual disability. They tend to have really long ears and long faces. Their joints are very loose and flexible, and many of them will have behavior problems and some speech difficulty. Autism is also very common. intellectual disability. It generally begins in early childhood and it can be diagnosed by 3 years of age. And there's a huge spectrum of autism, from very high functioning kids with autism where the symptoms, if they weren't tested, you might not even, most people wouldn't even realize that they have a problem, to where they are have difficulty functioning in society. So autism is a brain disorder. It has no cure, and generally the child's going to have problems with social skills. So they have verbal and nonverbal communication problems. They frequently do not like to be touched. Um, they do not like to be overly stimulated. They like things very routine. Just a small thing being out of place can kind of set them off. They have very repetitive behaviors, and so keeping with their normal routines, their normal behaviors are very, very critical. They have very narrow interests. They don't like to branch out to learn a lot of new things, and they get sensory overloaded easily. Okay, so if you're trying to overly stimulate them, try to do too many things with them at one time, they usually cannot control their outbursts and their behaviors. It is more common in boys, and the cause of it is unknown. Is it genetic? Is it environmental? I mean, there's been studies. I mean, for years, people were saying, well, it's all the immunizations that they get, but they've never been able to prove that. That's never been able to be shown. Is there a genetic component to it? So there's been a lot of debate on what truly causes autism. But people can learn to change or control their behaviors. They do need a lot of help, a lot of social and work skills to be able to function in society. So, and many times people with autism will have other disorders as well. Intellectual disabilities and seizures, for instance, tend to kind of tend to be common with autism as well. Okay, next we're going to look, I thought this was a really cute little thing that I found for autism. Always unique, totally interesting, and sometimes mysterious. I thought that kind of summed up a child with autism very well. Cerebral palsy is a term applied to a group of disorders involving muscle weakness and poor muscle control. So usually it is something that occurs at birth, right before birth or during birth or immediately after birth. And it may be from lack of oxygen to the brain. It may be from a difficult delivery. It may be from an infection that happened while they were before delivery, or a severe illness immediately after birth. But the defect is in that motor region of the brain, so it's usually to the cerebral area, which controls your movement. So they tend to have abnormal movements, abnormal posture, and their coordination is impacted. Probably the most common type is what we call spastic cerebral palsy, and they have just uncontrolled jerkings and discoordinated movements. There is no cure for this. They're going to need a lot of physical therapy, occupational therapy, to be able to function in life. The care will depend on the degree of brain damage, and generally there is some disabilities and impairments ranging from mild to severe. So our goal is to try to help them become as independent as we possibly can, and of course that's going to depend on the degree of problems that they have. Spina bifida is a defect in the spinal column, and the defect usually occurs in the first month of pregnancy. So the vertebrae don't actually form correctly, and it leaves a split in the vertebrae, which leaves the spinal cord unprotected. So you might actually see where part of the spinal cord actually comes out from the back, or you might just see a tuft of hair right there. And if you see that tuft of hair, they'll start doing tests just to make sure that the spinal column is protected. The lower back is the common area where this happens, and the treatment is going to depend on the type of spina bifida that they have. So spina bifida occulta is where the spinal cord just doesn't close off completely. There's a big gap in it. And so there's a weakened area right there that could potentially be dangerous. So a lot of kids that have spina bifida occulta don't end up having, you don't even know that they have a problem. If it wasn't for that little tuft of hair that tends to grow right there, that they start checking for it, you might not even realize that there's an issue. So problems can be anything from being normal, and being able to do everything, to having not being able to move the lower legs and stuff because this is, and not having good bowel or bladder function because this is weakened. Now, another thing that happens with spina bifida is you can get a meningeal seal, and a meningeal seal, you see here, part of the spinal cord right here, is part of the spinal column, actually outpouches right here, but the cord isn't there. There's no cord in it. So again, normally they can actually go in and normally surgically correct this. Go ahead and remove this from the back, close this area off, and if the spinal cord isn't hit in any way, most of these kids will do fine. They aren't going to have any long-lasting weakness or disability from it. Though there is always that gamut, just like with this one here. Though most kids do fine with this, you do have some that end up paralyzed. The same here. This is the one that's really tricky. It's called a myelomeningeal seal, and this one here, you have the outpouching of the spinal column here, but you've also got the nerves. The spinal cord is pouching out too. And this one, generally the kids have paralysis of the lower legs. They may not have bowel and bladder control. So depending on what type of spina bifida they have, it's going to depend on the type of symptoms and problems that you're going to see. And then the last one we're going to talk about is hydrocephalus. And hydrocephalus is when the cerebrospinal fluid collects in and around the brain. And it actually, frequently, hydrocephalus kind of goes hand in hand with spina bifida. But the head tends to enlarge really quickly, and it starts putting all this pressure in the head. Because there's no place for the extra fluid to drain off. And so the person's going to end up with intellectual disabilities or mental, and again, we don't use the term mental retardation, but what we would call intellectual disabilities, and neurological damage can occur if we don't treat this right away. So this is one of the reasons why, if you guys have kids, every time you take them in for a well child check, they always measure the circumference of the head, because they want to make sure it's not growing too fast. If it's growing too fast, they'll do some tests and make sure that the fluid, the shunts of the brain, are actually draining properly. Because if they're not, all that extra fluid is going to make that head keep enlarging and enlarging, and then it's going to put pressure on all the other tissue areas of the brain. And if you don't treat it, this child's going to die. So what they do is, and these are the ventricles in the brain. These white part here are the ventricles in the brain. And when a person has hydrocephalus, they start enlarging, they get full of fluid, and then that just squishes the tissue up against the skull. And so there's no room for that tissue to grow properly and to get blood supply to it and oxygenation to it. So they're not going to, they're going to have an intellectual disability, and they'll eventually die if we ignore it. So what they do is they put a shunt in. They actually put a tube into they go into the brain, and they put a tube here to drain this extra fluid, and the other end of the tube is actually threaded into the abdominal cavity, so the fluid is going to drain from their ventricles down into the abdominal cavity. And then what that does is it keeps the excess fluid from being in there. The normal brain tissue has room like it should. The growth of the head is going to stop, and they're usually going to do just fine. So long as that shunt stays open. So potential problems are vision problems, seizures, learning disabilities. Okay, depending on when they caught it, how soon they were able to get it under control. So I think we're going to stop there.